The coronavirus is all through southeastern Michigan, and it's not going to be gone until the vaccines develop. And so what we have to do is figure out how to live every day with it in a way that we are careful not to spread it.
Mayor Mike Duggan, thanks for joining us today on One Detroit and the Detroit News. How are you weathering these new circumstances?
Well, weathering them a lot better than I did 3 weeks ago when we had 600 police officers on quarantine and our hospitals were overflowing with patients. But things have come down dramatically. The people of this city have cooperated on the social distancing in, I think, a very good way, and we're in a much better place today than we were 3 weeks ago.
So you're seeing a very positive trend now in Detroit. Your last few press conferences have had more good news than bad. What's made the difference here?
Yeah, and the weekend was even better. We're continuing to see major drops in the death rate in the city. I don't think there's any question the social distancing worked. Detroit got hit probably harder and faster than anybody. You start around March 23rd, and we went from almost no cases to 40 and 50 people dying a day in 10 days, and you didn't have a room on anywhere in the hospitals. People were being sent home that never should have been sent home. But people in the city have completely bought in, and of course, nobody in the city has any trouble understanding that if you're African American and you get this virus, you're 2 to 3 times as likely to die from it as a Caucasian. And I think people in this city are watching out for each other. And I'm hearing from my fellow mayors who can't believe we didn't have to do a closure of the parks. We didn't have to put in a curfew. But if you drive around Detroit, you'll see a whole lot more folks out with masks than you will if you drive around the suburbs.
So where are we now in terms of next steps, Mayor? Where do you see the city going in terms of reopening?
Well, I think where we are today is where we're going to be in September, and is likely to be where we are in January, which is the coronavirus is all through southeastern Michigan, and it's not going to be gone until the vaccines develop. And so what we have to do is figure out how to live every day with it in a way that we are careful not to spread it in a rapid manner. And so today we sent back 400 outdoor workers, our roads crews and our parks crews. Every one of them has had to test negative before they're allowed to go back to work. They have their temperature taken as I do. Every morning when I come in, there's an administrator here who takes my temperature before I'm allowed to come into my office. We wear masks. I'd have a mask on now if I weren't talking to you. And we practice social distancing. There are a lot of jobs that we can bring back along those lines, and we're doing it. There's other jobs where, and there's been a lot of trend in this country in office space, as you well know, away from private offices and into large workspaces with people sitting next to each other in cubicles or along tables with workstations in front of them. It's going to be a lot harder, and it's going to take longer to bring those workplaces back because the risk of the spread is higher. And so what we're doing is bringing back our workplaces wherever we can in a medically safe manner, one at a time. And so far, it's going well.
And you see private businesses progressing along that same route?
Oh, I do. I think the governor made the right decision opening up construction this week. And I think most construction projects can be done well. I think the auto plants can be opened up. And I know the UAW and the automakers are working on those protocols right now. Everything we do is in a conversation between us and the unions with the doctor there. And we've had no problem getting union support. In fact, at the announcement where I said we're bringing 400 people back, the union presidents were there and were applauding the process. So if you show people what you're doing, I think we can create a workplace where you're no more at risk in 9 to 5 on the work site than you are on the weekends, and that's our goal.
And I know some other states have started to allow for outside dining at restaurants. Restaurants, bars, entertainment venues have been a big piece of downtown Detroit's comeback. Do you see those reopening soon?
So if you think in these terms, when people do contact tracing right now, they basically go back and say, who have you been within 6 feet of for 15 minutes? There's different ways to do it, but that's probably the average. And if you think about that from a workspace, it is going to be quite a while before people are sitting down in restaurants next to strangers within 6 feet. It's going to be a long time before you're at movie theaters or baseball games with that kind of distancing. But is there going to be a point in a month or two where you could have a quarter of the tables open in a restaurant? Maybe. I'm confident the governor will make the right decision at the right time. But we are focused now on jobs where it's pretty predictable who you're going to run into. Your fellow workers on the roads crews, your fellow workers in the office. And those are the easier ways to bring back, and those are the ones we're starting with.
So one of the things you've been advocating for is to allow hospitals to start treating non-COVID patients again, people with chronic illnesses,
Right.
and perhaps even start doing elective surgeries. Why is that important?
Yeah, they need to get going on this, and the governor's orders actually allow a great deal of it. Some of the hospitals are more aggressive than others, but before there was COVID-19, there was a healthcare disparity in this country based both on income and on race. And the fact is that people in Detroit have higher rates of diabetes, heart failure, kidney disease. You go right down the list than the general population. And that means you need to have more access to your doctors and your hospitals, not less. And people were so frightened 3 or 4 weeks ago to go near any of these providers for good reason. COVID-19 was everywhere in these doctors' offices and these hospitals. But health systems know how to separate infectious from non-infectious people. You do it all year long. And whether it's tuberculosis, whether it's seasonal flu, whether it's HIV, these are just normal practices. And I think the biggest problem right now is, and I've talked to every one of the leaders of the healthcare systems, I don't feel like the healthcare systems are doing a good enough job of explaining to the public that this isn't 3 or 4 weeks ago when the gurneys were lined with patients in the hallways. This is a normal setting. In fact, if anything, the hospital volumes are lower now than they were a year ago. And the hospitals can manage this. And I think it's really going to be up to the hospitals and the healthcare system to explain to people, we can treat you safely, come on back. And I think you'll see that happen in the next couple of weeks.
So you're a former hospital CEO, used to run the Detroit Medical Center. How important is these elective surgeries in terms of keeping hospitals afloat?
Well, they're more important than keeping hospitals afloat. Elective surgery is something that somebody else has to have. You need angioplasty. You're walking in pain with you needing a hip or a knee replaced. You need a biopsy. I mean, they've been deferring biopsies for people suspected of cancer. These, to me, they may be technically elective in that you're not going to die from them tomorrow, but some people are going to die from them if you don't move them forward. And so, in my mind, the only truly elective cases are facelifts and liposuctions. If it's not cosmetic surgery, there's a medical reason for it, and we need to get back to proper medical care. And I think all the hospitals and healthcare systems are ready to go on this. They're going to have to convince the public that the public can be confident going into their healthcare system and not have to worry about catching COVID-19.
So you say you've talked with all of the hospital administrators. What's the situation in Detroit's hospitals? Are they brimming? Is there still room?
There's more than half the ventilators are not used today. There's 700 or 800 vacant beds just in the Detroit hospitals today. We would never have seen that a year ago. You might have seen 200 or 300 beds. So what happened was a lot of people with a lot of problems decided to avoid the emergency room, decided to avoid hospitals, decided to defer procedures. And that's okay for a couple of weeks in the middle of a pandemic. But right now, people need to get their health care taken care of, or we're going to have deaths not related directly to COVID-19 because people didn't seek care. So you're going to see, I'm really confident you are going to see messaging coming out of the healthcare systems that you can safely come back. And I think that's going to be the next step that we see.
Mayor, let's talk about Detroit's economic recovery from this. How difficult is it going to be for the city to get back where it was in terms of economic activity, as well as tax revenue coming into the city's coffers?
It's going to be a mixed bag. I think the construction side is going to come back fast. There's a lot of people anxious to go. I know FCA is anxious to get going on the Jeep plant they're building on the east side, and most of the other contractors are ready to go. But Detroit is also very much driven by people coming into theaters, people coming into sports events, people coming in, being packed into restaurants. That's going to come back a lot more slowly. And so you're going to see a mixed bag. On the other hand, we're going to have, I expect in the next month, announcements on two major employers who are going to locate to the city of Detroit. So we are, I think, very attractive for the long run for a lot of reasons: the affordability of our housing, the speed with which you can get permits and build here, and a lot of other things. So you're going to see new development, I think, continue to come, and the opening of the entertainment sector and the casinos is probably going to depend on the development of the antivirals, the development of a vaccine, and things that are outside our control.
Vaccines may be months or a year off. Can you do without that casino revenue for that long?
So I would be surprised if a vaccine would develop in this country within a year. Figuring out what the vaccine should be is one thing. Figuring out the right way to do it so you don't inject people with something that gives them the disease is far more difficult for any vaccine. So I don't think it's going to be rushed in as some people may be talking about. And so we're going to have to deal with it. Do the casinos end up opening at 25 or 30% capacity? I don't know. Those are things for the governor to evaluate based on medical advice when the time comes. I'm not going to push for anything to be done before it's medically safe. But my guess is in a few months, you'll see restaurants, you'll see casinos, you may even see movie theaters operating at 25 or 30% capacity with some real social distancing restrictions. But that's a little ways down the road. Right now, we need to get the construction up and running. We need to get the auto plants up and running. Those things are easier to do safely than restaurants and theaters.
So, Mayor, I know you've made some budget cuts there at the city of Detroit trying to get ahead of this thing. But as this prolongs, what's at risk for the city in terms of spending cuts, pension payments, et cetera? What are you most worried about?
Well, the pension payments are in good shape. We set aside money for them ahead of time. And we set aside a lot of money preparing for a downturn, which has eased the initial impact of this. But if we get till the end of the year and the economy is not coming back, then there's going to be serious cuts to be made. But I got to tell you, I've been so impressed with City Council the last 2 weeks. They're going to adopt a budget tomorrow, but you haven't seen any drama, any fighting. You look at Lansing, all this protests and stuff. You're going to see Detroit City Council adopt a budget that cuts $350 million without any of the sideshows you've seen in the past. And Council President Brenda Jones and the Budget Committee Chair Janae Ayers, if anything, they've been emphatic that we make sure we cut enough because nobody wants any part of an emergency manager ever coming back.
So where do those cuts come from?
Well, we had huge reserves to start with, at least for the city of Detroit. We also are basically going to defer $80 or $90 million of demolition. And the blight effect in the neighborhood is going to be a problem. There's no question about it. There's a choice between that and cutting police and fire. And then there are a number of services that are going to be slowed down for a while. But I don't think Detroiters will see, outside of the blight removal, I don't think Detroiters will see huge reductions. You won't have any rec centers operating this summer. But that wasn't a lack of budget. You couldn't have brought people together in crowds in rec centers this summer anyway. So we cut rec center costs out. Those are the kinds of things that we've done so far. Where we are today is manageable. And we got $348 million deficit. Bill de Blasio's got a $10 billion deficit. They got a whole different level. And Las Vegas, basically lost all their revenue. So there are cities a lot worse off than us. But I think if City Council continues to behave the way they're behaving, which has just been really great leadership, whatever we have to do, we'll get through it together and responsibly.
Finally, Mayor, Detroit's economy is built. You mentioned some large employers coming in, but it's built in large part on entrepreneurs, small business people. What sort of help is going to be available to them to get them restarted? And how many of them do you expect to lose because of this?
So there have been lots of different support programs. Of course, the SBA program the federal government did was a good help. We've had several $1 million donated from philanthropy that have helped keep them afloat. And so it's going to be an interesting mix. I think it's possible a clothing store, an art store could open relatively soon with people wearing masks and coming in. I think if you've got a small restaurant where tables were on top of each other, it's going to be a lot harder for you. And it's really unfortunate. You look at Livernois this summer. I expected Livernois to be jammed from one end to another with all the improvements we've made with outdoor cafes and the like. And it's kind of heartbreaking to see that we aren't going to be able to do that. And so what we're going to do is every business that can get customers to come in and out in a safe way, I think those have a real chance of getting restarted. Those that require customers to sit together in close proximity of each other, I think those are going to be tougher. And it's almost going to be a business by business kind of issue.
Mayor Mike Duggan, thanks for joining us this morning.
Thanks
We
for having
appreciate
me,
it.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.